is our time.
Hi guys, today we're here with Kate and it is time for Polly to have the physio. So Kate is Polly's physiotherapist and we're going to show you what happens during the visit. And Kate, I'm going to ask you loads of questions, so I hope that's okay.
Of course it's fine.
So what paces do you like to see them in?
So generally I'd like to see a trot up and a lunge. Today we're just looking at her lunge. So to start with, we'd normally start with walk, but she's quite excited today because she's not been in the field. So we're letting her have a trot and a canter first, and hopefully she'll quieten down. And this gives her a chance to loosen up as well. Already I can see, so if I start at the front, she's quite tight at the top of the neck. She's not as soft and as loose as I'd like her. And through the shoulders, I'd like the swing of the scapula to be easier. She's just not quite as loose. She's not quite as free as I'd like. And then that goes through to the back as well. If we look where the saddle would be, I'd expect a little bit of a bounce underneath the saddle. It looks tight. And then moving on to the hindquarters, there's not, again, the same thing. I'd like more swing through the pelvis. I would say on this rein, she looks tighter through that right gluteal, tighter down that right hind leg. She's the sort of horse you'd expect that after 15, 20 minutes of work and of stretching, that she would be looser. Could we have a canter?
So when you're seeing them, would you prefer them to go out in the field first, or would you like to see them from the stable? Or does it not really make too much of a difference?
It depends on the horse. Mostly I'd probably prefer them to have been out first, so they're more relaxed and more chilled. Otherwise, sometimes a pony like her would take 10, 15 minutes to relax before you're seeing her proper paces.
Yeah.
She's already starting to relax after the canter, starting to move looser and more free through the shoulders.
Yeah.
I still look at the pelvis and I think that's to me, that area at sort of the highest point of her pelvis and down the hamstring just looks tight, tighter than I'd like.
Okay.
Great, have a trot. Sometimes you come out and you do see that they are lame, and they're the ones that generally, although I'll carry on with the assessment and I'll feel them, they're the ones that'll have to go to the vet to investigate the lameness before we can really do any physio on them. Sometimes you feel guilty doing that because they are in pain and you don't want them in pain, but equally they need to see the vet to find out what's causing all the problems in the first place. But with her, she looks tighter and a bit stiffer than I'd like, but not something I'd be worried. Great, see if she'll have a walk now. Now she's doing something. So I think that the second trot after the canter, she looked better through the neck. The neck was softer and swinging, and in front we just had a slightly longer stride length. Just looks softer.
Yeah. So why do you like to see the ponies move on both directions?
So the ponies will move differently on each rein. On each rein you're putting more weight on one side and we're asking for the bend through the body on each side. Ideally, you could spend all day looking at a horse. Ideally, you'd do a trot up and sort of on a hard surface, on a soft surface. You could look at them lunge on a hard surface and soft surface. You could then see them ridden and assess the tack. So it does depend a bit on the problem that I'm going to see the horse. If the horse has got a specific ridden problem, I will always see them ridden. And if it's more of a hacking problem, then it's important to see them on you try to assess the problem as to how you need to see them move.
Yeah.
But this is, I would say, as a basic movement, the lunge is the best one because you see them on a circle.
And do you see a difference on soft surfaces and hard surfaces?
Yeah, very much so.
Would that be because of like the soft tissue? Or?
It depends on the problems that the horse has got. So often older horses who have more joint problems on the harder surface with a concussion, they'll struggle, whereas a young horse might look better on a hard surface. But if they've got a soft tissue problem, if you put them on a surface which is deep, they'll really struggle.
Yeah.
So I would say, looking at her, that this right hind is her stiffer hind. She doesn't find it as easy to step through. So you could see that when she was on the left rein, but it's even more noticeable on the right rein.
And is that because it's on the inside of the circle?
Because you put it on the inside of the circle. You've just made it harder for her. And she wants to look to the outside of the circle on this rein. She's trying to take a bit of weight off that inside hind.
So if you were to then add a rider, would the weight increase that, or could that depend on the rider's ability?
It does depend on the rider's ability. Sometimes if it is just a bit stiff, you can have a rider who will naturally ask a bit more movement from that right hind and be able to supple the right hind. If you had more of a novice rider, they would struggle to get them to come on the right rein. I think whatever, they'd probably find her more difficult to ride on the right rein.
Yeah.
What you often find is in canter, it changes from the inside hind, them finding it more difficult on the inside hind to it finding it more difficult on the outside hind. So actually in canter, she finds it easier. The propulsion comes from the outside hind in canter. She does look, a lot of it is tightness. You can see once she's warmed up, she's so much better. If you compare, if you want to look back on the video, if you compare her trotting now compared to her trotting at the start, it's a different pony. You do have to wait for them to warm up.
Yeah.
That's great. Stay in trot. Yeah, just stay in trot for a bit. The front legs now are so much better than when she started out.
Yeah.
To start with, and the neck as well. There's movement through the neck. She's a difficult one to assess in walk because she in all the other paces she's quite forward, but in walk she doesn't go forward. So it is a difficult one to assess with her. So what I want her to do is do a sort of a turn on the forehand, so she's crossing the inside hind underneath her. So with this, I'm looking for the inside hind to be happy to cross in front of the outside hind. She can do a small circle in front. Brilliant. And the other way. You can also see problems in stiffness through the body, that if they're really tight through the body, they won't want to.
Round again.
That's great. So there was a little bit more crossing on the left hind than the right hind again, just showing the stiffness of the right hind. And then just a few steps rein back. Lovely. Don't worry. So rein back's a difficult one because it depends on how well the horse is trained. So the trained horses will step evenly back. You're looking for a diagonal step backwards. But if they're not trained in reining back, then they tend to veer off one side, or that's fine, that's fine. If they're not trained in it, they don't understand what you're asking. Yeah. But you can see if they're very uncoordinated, it can suggest neurological problems, as can the crossing of the hind legs. And if there's other soft tissue problems, they can really drag the feet back rather than doing a proper step. So it does show you other things, but it's difficult when they're not trained in it. So I'm going to start at the front. I've had a look at her. I'm going to start having a feel of the jaw and around the head. So I'm going to have a feel how her jaw moves by holding here. Darling. And I'm feeling how the sort of sweep of the teeth and the movement, and just feeling, you feel both sides. So she doesn't move quite as easily through that side. A lot of horses are stiffer on one side or the other side. They can also get really jammed, and then they can be very upset because they can't, if they're really locked through sort of the jaw and the pole, they can't accept the contact, and they can't come down to accept the bit. So we'll have to do some work on that. Have a feel of her to start with.
Yeah.
So I just go down feeling the soft tissue, the muscles, and then just gently moving each of the joints. And again, I'm feeling if there's muscle spasm, or if there's any soreness, if she's reactive. And you can also feel if the muscle isn't working, if it feels like it's not doing anything, if it's dead, if sometimes when they get very tight and they're not using a muscle, you can feel that it just doesn't react as you expect it to. So the bones in the neck are a lot lower than you think they're going to be. Everyone thinks they're up here, but actually this is all just fat. Bones come down here, so I'm feeling each of the bones, each of the joints. So as we watched her on the lunge, we could see that she was tight through her neck. No muscle spasm, but just tighter than I'd like. I can get through the front of her scapula. Which is good, you're a good girl. And again, I'd like her, she's not in pain, but she's tighter through here. I'd like her looser behind the elbow. So moving on to her back. This is classically an area, if the saddle's been too tight, if there's been any bruising, that you can get some muscle spasms, some soreness. Again, she's a little tighter than I'd like, but no muscle spasm. There is a little bit of a reaction just at the back, at the back of the saddle. And you can see she doesn't like me touching there. This is an area where you'd expect pain from everywhere though. The back of the saddle sits on it, so it can be that the saddle's been too low here, or the rider's classically the saddle can sit the rider too far back, and so the weight comes too far back. She's also quite short to fit a saddle on, so if the saddle's been too long, then you can have problems here. Any front leg lameness can cause muscle spasm to the back. Any hind leg lameness can cause muscle spasm to the back. So quite often when you feel muscle spasm here, it could be anything. So this was her, on the lunge, I felt this was her better hind leg. I felt this moved more freely. And feeling these huge muscles again, I'd like her a bit looser, and on the inside of the hind leg. When I'm feeling down the front, they can be very sensitive around their stifles. So I'm more cautious if they're quicker.
So what are you kind of feeling for when you're feeling for muscle tightness? How does it feel under the finger?
Muscle spasm, if you see this area here, can you see the twitch of the muscle? So that's, I'm not pressing hard, but you could, this I would say is muscle spasm. This would be sore. Possibly not enough to affect her riding, but it's uncomfortable for her. This area through the neck, it just feels, so feeling up at the pole, the joint doesn't move quite as well. I'd expect to be able to move her neck easily. It feels tight and stiff. She doesn't want me to move it. And the muscles above, there's no spasm, there's no pain, but they just feel harder when I'm pushing on them. They don't move away from my hand as easily as I'd like. So they're sort of different, they're different feelings for different problems. She's the same really neck-wise and shoulder-wise, she's the same on the left and the right. So she's fairly even through the front. I'd like her looser, but...
So I guess you'd probably want it to be even.
Yes,
Yeah.
If it wasn't even. Most horses aren't straight. Most horses will be stiffer on one hind and they'll load the other shoulder and they'll be stiff through the neck. So you feel that crookedness all the way back. She's stiffer on the right hind, but she's quite similar through the neck.
That's good.
But that might be, if she's had good people riding her, you can ride them straighter. So they've kept her supple in front. They've not been able to entirely get rid of the right hind stiffness, but they've kept her fairly straight through the front. It's more difficult for novice riders. It's much more difficult because you only ride one horse and they will put you where they want you to go.
Do you see discipline-specific patterns in ponies?
Oh yeah. In problems, the dressage horses and ponies, they can get tighter through the neck and through the shoulder, and classically through this wither area here. What we want the dressage horse to do is lift up through the back and carry the back. And where they're often they just get tight, so I'm doing a lot of work around the thoracic spine. The show jumpers, they can get tight through the shoulders if they're jumping big jumps, and they can get tight classically through this pelvis and sacroiliac joint, where again they're having to kick the hind legs away.
So when it comes to the event ponies, Do
they can have everything.
They have everything.
And then they slip and they fall and they have to go through deep ground and hard ground.
Yeah.
Again, it depends. In the summer, we're having hard ground problems. In the winter, we're having slips.
Yeah.
So this hind leg is, even as she's standing, it's quite different. So she's a lot, there's almost a dip here. So we've got muscle spasm here. Then we've got a dip where there isn't muscle spasm. And then we've got the tightness through these gluteal muscles. And also she's tight down the inside of this hind leg. And you can just see she's just a bit uncomfortable compared to the other side. So I just have a basic feel of her legs. If you're feeling the heat, swelling, lumps, bumps, all the things that you would do when you're checking on a horse's leg normally. And I'm feeling how easily they lift it. So already this side, she tends to come in. She's guarding. She's more protective of it. And she's not as easy to loosen. And this won't come out as far. But actually, range of movement wise, she's good. So again, this right hind. So treatment plan wise, I've got a bit to do through the jaw and the pole, through the neck and the shoulders. And then my primary area is this lumbar spine and into the gluteals and down the hind leg to release her hind leg off.
Perfect. Oh, sounds good.
So not every horse enjoys this, but we'll see. Ideally, I'd like her to get her to rest her weight on my shoulder and relax. Sometimes once you've seen them a couple of times, they start relaxing into you. I don't know if she's going to quite trust me enough today, having just met me.
And do you see problems being caused maybe through their tack, so like their bridles, for example?
Yeah. 20 years ago, I would have laughed if someone would have said to me they're going to get their bridle fitted to the horse. Now, to be honest, I think we have to, because they all have different size heads. We need to make sure it's comfortable. We've got the headpiece, the noseband needs to be the correct, it needs to be right, or they're not going to be comfortable. And again, with the bitting, I mean, the sort of, when I started this, there was no such thing as a person who came out and tried bits. But now, to be honest, I think you need to, because every horse has a different shape, sort of mouth and tongue, and you do need to find what suits them and what they're most comfortable in. And
how about the use of hay nets?
That's always a difficult one, isn't it? Ideally, we'd like everything to eat off the floor. It's more natural, it's better for them. But that said, if you've got a fat pony and it's going to eat it in 20 minutes, I don't think you've got any choice. No. The newer ones, sort of like the box ones with the bars across to slow them down, they're good. But again, if you've got something that's going to climb into it, that's not safe. So I think you have to work with what most suits the horse.
Polly loves her hay. Bit of a fatty.
I know, we can't leave them without food for hours and hours and hours, so we do have to find some way of slowing them down if they're little fatties.
She looks like she's enjoying that.
She's been very good. So the treatments that I'm doing are a mixture between soft tissue treatments to release the soft tissue and then joint mobilisations.
And would you always start from the head and work your way backwards?
I do, except if it's a stallion. So most horses I would start, because they're more trusting if they can see what you're doing, and they normally like their neck to be treated. So I'll always start at the neck, because then when I get to the back end, if there's a little bit of soreness, they've normally bought into it by then. But stallions, if you start on the neck, they can get a bit amorous. Okay. So I start on the other end and I finish on the end, they're going to get amorous.
Clever.
Hello. Oh, click. So with the joint treatments, I have to come quite low and I have to push it up, and that's a little bit more uncomfortable for them. She goes like the soft. They like the soft tissue stuff. They're never so keen on the joints. You want them to enjoy physio. You want them to, because then they'll relax and they'll let you in.
If you treat a particularly sore horse or pony, are they a bit more guarded?
Yeah, so there's been some where I've been in there and you've had an hour and a half of battling with them, and they've been blocking against you and moving away, and you come out exhausted after an hour and a half, and you think, I've done 10 minutes of decent treatment, but actually you go back the second time and they remember that you made them feel better, and they can be different horses. Yeah. A lot of physios do a lot under sedation. My preference is not to. My preference is to go and battle with them for an hour and a half and do the 10 minutes that they like, and then hope that when you go back the second time you can give them a proper treatment, and mostly that works. There are some which you just can't get near and you do need to sedate, but I would rather take 3 treatments to get things used to physio rather than just sedate it. You are such a good girl. I'm going to take this off, so don't take advantage. So this side's a little bit easier. Now we've treated the other side, she's generally a bit softer. You can see I can get my hand more into her neck. Yes. Yeah. So with her, the tightest there is up at her pole. Do you find that horses hold their tension like people in different places? So some of them hold it in their jaw, some of them hold it through the top of their neck, and some of them hold it in their back. So I think part of her is that she holds her tension through her, through the top of her neck. A lot of the time it's the first pressure is uncomfortable, and then once you're on somewhere they start relaxing into it.
What are the signs that she is maybe releasing any tension? Or?
Again, I often look at the eyes. People like them licking and chewing. I do find that some horses lick and chew loads and others just don't. That's just not their way of relaxing. So, but you find the nose relaxes and the eyes relax, and I can just generally feel them flop.
Just like that. Right on cue.
It's really rewarding to treat them because you do feel them relax. They do respond really well. They're very tactile, all of them. I don't think I've ever met a horse that hasn't eventually relaxed and enjoyed being touched. And
I guess for you, when you come back time after time, you see the results as well.
Yeah.
Which is nice.
A lot of what I do is dressage horses. And with dressage horses, little things matter. So a slight tightness in the half pass, or them not stepping under evenly with one hind leg and the shoulder in, you lose marks for those things. So a lot of what I'm working on is improving sort of bits of lateral work, or improving the openness of the shoulder so we get better mark, so the medium paces improve. Dressage horses, often I'm seeing every 6 weeks, to be fair.
Really?
through the dressage season, I'm seeing them a lot.
Yeah.
But it's not for soreness or pain. It's for improving their way of going.
So how about kind of for a pony club pony? How often?
For pony club ponies, depends how old they are. The older ones need more physio.
Yeah.
The younger ones less physio. If they're at the top of, it's the same with any athlete. If you're asking them at the top of what they're capable of doing, they're going to need a lot more physio than if they're jumping 40 centimetres and they're finding it easy. So it really does depend on the horse. So again, with the back, it's similar to the neck. I'm going to release the soft tissues, and then we'll try and mobilise the spine.
How did you get into your job being a physio?
So I was working for a dressage yard as a groom after I finished my A-levels, and I was earning about 80p an hour, and I was mucking out quite a lot of horses, and I thought, I don't know that I want to be a groom forever. And I was really lucky because I'd done okay in my A-levels, so I was able to get on a physio degree. When I qualified, the only way of being a horse physio was to be a human physio first. So I did my human physio degree, and then I went on to be a junior physio in a hospital, and then I did a master's degree at the Royal Veterinary College in veterinary physio.
So how long did that take in total?
You don't notice it really, because the
No.
first degree was 3 years, but then you're working and you're doing something you love anyway. So sort of the bits of training and the other thing that's sort of on top of extra work, I don't think, probably if you added it all up, it must have been about 6 years or something.
Yeah.
But you're working, you're earning money, and you're doing something you love. So it's not, it doesn't feel like, oh God, it's going to take me 6 years to qualify. Whereas I think sometimes if you're doing vet med or something like that and it's 6 years, you must be at the start thinking, oh, 6 years is a long time. But it wasn't, I don't think it was like that.
So do you do humans and horses?
Yes, yeah. I do mostly horses now.
Yeah.
I used to treat dogs as well, but you do eventually run out of time. So I picked horses over dogs and then carried on treating people as well.
Do you do a lot of riders?
No, I used to do more riders. Now it's difficult with time. Eventually, when I get more time, I will start doing the rider and the horse assessment together, because that's your ideal, isn't it? Is you watch them both together and you can work on the weaknesses of both. But that would take me too long at the moment.
Would you see quite a lot of issues with the rider and the pony that might be similar?
Yes. And I do, of course, because I do watch people ride, and you can just almost guarantee that the horse's weak side will be the rider's weak side, and you think, oh, okay, so, and I do give sort of people ideas and hints and send them to physios and sort of let them know that their weak side is the same as their horse's weak side, so they both need to be working on it.
And I guess if you had a wonky pony to start with, could that then go on to the rider and vice versa?
The problem with only riding one horse is that horse will put you where they want you. So if they want to shove you to one side, they'll put you there. If you're riding more than one horse, you get a feeling of your own straightness. And then you'll get on the horse and you'll keep shifting yourself straight. But on only one horse, the pony will train you.
So it's a good thing to ride lots of
It
different
is
ponies.
a good thing to ride lots of different ponies, and it is a good thing if you're given the opportunity to ride other horses or go on the simulators or just go for a riding lesson somewhere else on a different horse. It will give you a different feel. So when working on the lumbar spine, I also work on the pelvis, because we've got big muscles going from the back into the pelvis. So we release through the pelvis. So this is a harder area to release using just physio techniques. So with this, I'm looking to contract the muscle. So I'm putting pressure on and then asking the muscle to contract and getting a movement then through the back of the muscles. And then I use a reflex just to lift the back a little bit. Sorry, darling. Good girl. So with this, I'm looking to lift, looking for the back to lift slightly. Sorry. So when I'm treating the back, I'll do a little on the back, on the pelvis, on the back, on the pelvis, and I'll jump from one to the other.
And why is that?
Just because they're a part of each other.
Yeah.
So you have to treat both ends. You have to treat both ends of it. I couldn't get this loose and this still tight. You have to loosen this, and just you work your way through.
Are there things that we could, as owners, look out for at home? Or like signs that we should be looking out for?
So it's about listening to your horse all the time. Is listening to when they're happy, when they're not happy. Are they swishing their tail? Have they got their ears back? Are they happy to have the saddle and bridle put on? Are they happy to stand at the mounting block when you get on? Are they happy to be groomed? Are they happy to be clipped? A lot of in the winter, I see quite a lot of horses because they get an external person out to clip them, and that person says they've got muscle spasm all across their back when they've clipped them. So it's just about constantly being aware of how your horse feels. When you start out, it's useful to have it's useful to have like a checklist of health, I would have said, or how to assess something. When my little girl was little, we got a hamster, and they gave her this like 10-point plan how to check the hamster. I'm not sure it was very nice for the hamster because it involved the hamster being tipped on its back every day and having its teeth checked. And I was thinking, I'm not sure the hamster enjoys this, and she did it religiously every day. She checked his little feet, and she checked his droppings, and she checked his teeth. And I think horses, it would probably be beneficial to do the same thing with them. Every day you run your hand down their neck and their back, and you feel their back. You run your hand down their legs. The top level riders would never go through a day without checking their horse's legs. And if you've got ponies, probably checking the pulse and checking the heat of their feet. Because if you're checking it every day, you become aware of what's normal for them.
New pony, it could be quite hard to know what is normal.
Yeah.
For them.
And I do hear that a lot is when I go to see them, or I go to see them and I sort of say, oh, it's not happy doing this, or it's not happy, and they say, well, it's always been like that though.
Yeah.
And it's like, well, that doesn't mean that it's right.
Yeah.
It's probably always had the problem that you've had since you've had it. And of course animals have problems. They're like us. They have stiffnesses and tightnesses and sorenesses and things that perhaps we can't get on top of, but they're the ones that you need to see the vets, and the vet, you would need to come to sort of a decision with the vet as the best that we can do for that horse.
Do you work quite closely with vets then?
Yes, yeah. And a lot of what I do is performance stuff. It's trying to improve horses' movements, or the bend, or the lateral work, or improve its jump sometimes with the jumping horses. So a lot of it the vets have, they don't need to get involved with. That's not really sort of what they're interested in. But certainly if I see ongoing soreness and any lameness, and of course if something's been diagnosed, we'll work together to rehab it.
So this tapping that you're doing,
Yes.
How does this work?
So I'm putting pressure on the muscle with that hand, and then I'm causing a contraction with my other hand, and you can see the muscle bounce. And they don't like the noise, but they don't genuinely mind it. And some of the mares love it actually. They really like it. There are some sensitive ones you can't do this with.
Is that similar to what an H-wave?
So an H-wave that's an electrical stimulation that we put that goes through the muscles and gets a muscle contraction. Okay. This is more, I would have said this in more of a specific place.
Okay.
So on this, I've got my hand on her seat bone, and I'm pushing that way. They normally like this too. And again, this just releases the pelvis. I keep my hand here, and then if she moves her leg, then it pushes me away, because it's not very healthy and safe thing. On some horses, if they're very crooked, you can feel that they can't move. I should be able to move them in a straight line. On some, you just feel like you're veering away. And again, that's because the tension is not allowing the pelvis to move straight.
So we obviously recommend not standing behind ponies.
No, don't stand behind your pony.
You find yourself in very different positions. Have you ever had any near misses or?
I've got my hand here, so
Yeah,
if they do something, I do.
Yeah.
I do get. I've got it. This is braced, and if they do anything, then I can just push myself off them. But yeah, you always get more squashed, I would have said. I've had my toe trodden on quite a lot.
Yes.
And a few little nips. If they get angry at something, they'll nip you. There is a bit of judgment involved in who I stand behind. I wouldn't
Yes,
stand behind every
sure.
horse. So I am going to do a little hop behind. Normally I do this on a softer surface, but I just want to release a bit deeper into the pelvis. So I'm just going to slightly lift the hind leg up. And I want her to push on my hand, like that. And she's using her muscles to stretch herself through the pelvis. No. So that was a hop. She didn't push down, she has to push down. Good girl.
And what is this helping to do?
Again, this is for the pelvis.
Okay.
Right. That's a horrible bit done, so it's time for the stretches. With a million different carrot stretches you can do. If you look online, they will give you lots of different ones, and everything stretches something different. This is a nice basic one to the middle of the flank. You want to get to there. This is one of my favourite ones. So I'm going to go behind the elbow, and I'm going to aim for the middle of the tummy. And you will see that she will lift, but she'll also twist as well, which is a very functional movement for them.
So could we be doing these at home then?
Yes, absolutely. I would do. Depends. Ponies can be a bit nippier. Ponies sometimes only once a week. Horses can do it every other day, ideally when they're warm. You're cheating with your front leg. Come on. So you want to have them as square as you can before they do it. That's square enough, I suppose. Try between the legs. Between the legs. Oh, she's good. Some horses don't like going beyond their eyes, so some don't do very well between the legs.
And how long should we be holding this kind of stretch for?
Depends how long you can. I mean, some horses you can hold for about 10 seconds. I might be able to hold her there. No, she pinched it. So you can either do 3 stretches or you can just hold it there.
Okay.
Again, if they really struggle, if they are struggling with their carrot stretches, they probably do need to see someone to release them because they should find it easy.
Yeah.
This is really the thing that the ones that benefit most from it are those horses in their 20s. Good girl.
So this is to be done after exercise?
After exercise, once they're nice and warm, once you've ridden them, as their treats, a few carrot stretches, and then you can do it every time you ride.
Yeah.
And then it's easy to fit in. She's run out of sweets.
So that is Polly done. I think she really enjoyed that. How kind of long do you think she needs off? Does she need any days off?
So with her, she certainly needs a day off. I've done quite a lot, so I would say tomorrow and then a day's walking after that. In terms of her rehab programme, I'm going to get on a programme poles twice a week. And warming up, she needs a proper warm-up before she starts. So she might be one who I, at least over the next couple of weeks, get to do a couple of poles before you get on, so that she's nice and warmed up when you start, rather than having to ride through that 10-15 minutes with her being tight. So I would prefer her to be loose when you get on, and a 10-minute long rein, if you can, to get her to relax.
And how often would you like to see her?
So I'm going to see her in a month's time.
Yep.
After that, again, it's going to depend on her. After that, it will probably be 3 months. It might stay at 3 months, or it might then go to 6 months. If she was just going to be a hacking pony, it might be a year. And some cobs, to be fair, only see every 3 or 4 years. I mean, it really, really depends on the horse.
Oh, well, thank you so much.
No, it's a pleasure. It's lovely to meet her.
She can go in the field now.